In life spanning, there is no plan B. I'm Jean Faracaba, and my guests are coming to this podcast for a reason. There's no rules, no BS, just pure biohacking. I don't want to know what you have to sell. I want to know who you are. Hello folks, welcome to the No Plan B. Today I have the pleasure to have a friend over, Polish Mike Turajczyk. Mike, I'm so honored that you're coming to my podcast. I was on yours recently. Our friendship is a long story. We met by coincidence in the lobby of an hotel taking a coffee. Someone came to my shoulder and goes like, "Hey, are you Cyborgains?" And I go like, "Yeah." And this dude was just like, "Oh my God, I've been following you for a long time. I'm a fan. I love what you do." And I go like, "I'm freaking honored." We learned about each other. We became very good friends, I can say. Every time we bump into each other, we spend time together, we talk. We know the same people. Patrick Porter, Dr. Patrick Porter from BrainTab. We've done a couple of podcasts together where you were behind the camera and behind microphones on the other side filming, because you run an agency that is quite cool, Polish My Business, and you also have another group and business and mission that is more into healthcare and doctors and networking with those doctors. Mike, welcome to No Plan B. I'm so happy to have you, my man.
Thank you. Very, very happy to be here. Always a pleasure to spend time with you.
It is always a pleasure. So, you know what? I'd like to jump straight into the healthcare system that you are trying to change. I've read, I don't remember where it was, but I think it was on your LinkedIn profile that you were saying that you want to change 1 million people perspective about healthcare. Why just 1 million? There's 8 billion people on this planet.
Correct. And our mission and our goals are going to be evolving along with us evolving. So this 1 million is more of an achievable goal that I see right now. I do want to have something that feels attainable, realistic, and then of course when we hit it, we're going to expand to something bigger. But I think it is important. Our healthcare, as you know, a lot of people are talking about integrative healthcare, but they don't know how to practice it.
Well, you know what, Mike, before going into that detail, I think that everybody on this planet today is talking about many things that they don't know. And integrative healthcare, integrative medicine, as biohacking, as life planning, as everything, many people don't even know what they are talking about. So your mission is to make that like mainstream, known, redefining what it is, or go for it?
For me,
yours.
Everything is around promoting integrative healthcare. And that's in multiple different meaning of that word promoting. It's not just, marketing it and branding healthcare providers, because this is just one part of it. For me, promoting is advancing, is improving, is also improving the rank. Right now is that one thing that people consider as, this cool viewpoint and a way to practice healthcare. For me, it is the way to practice healthcare.
Okay, so please, Mike, before you go on the ranking and everything, give us the definition of what it is.
So integrative healthcare, you will find a lot of different definitions for both integrative medicine, integrative healthcare. For me, I like to always simplify very complicated concepts. So for me, it's a way to practice healthcare that combines the conventional healthcare and conventional treatment with the complementary approaches. And that's done in a coordinated way. So conventional treatments combined with complementary treatments.
Conventional treatment, conventional means like medicine in general.
Medicine, as it's surgery, standard of care, but actually in the best definition of that term, standard of care, because a lot of people complain about it, and I think there is a lot of good that we can find in the current standard of care with complementary. And I'm not using the word alternative medicine or alternative health, because alternative implies that it's one or the other. And for me, in whole life, everything that we do, everything that I do, everything that we do as a group, as a family, it's all about collaboration. So it's not really alternative treatments, it's complementary treatments, supporting treatments that, there is a big void in the standard of care, and people practicing it, they know. And then there is also this other side. So for me, the goal and the mission to promote integrative healthcare is not just to make it more known and to, have people go towards towards the complementary medicine, but to actually integrate both.
Brilliant, intelligent. Most of the time people try to succeed by rejecting others, combining competition and fights. You try to succeed by actually making harmony, which is brilliant. Do you think it can work? Some people, like I know that from the holistic point of view of alternative medicine, they reject completely the medical system. And some doctors have this mindset of completely rejecting whatever is under the holistic or alternative medicine approach. How are you going to be the pacifier there?
I like it, pacifier. And I see myself as in a the definition that I would put to that pacifier. There needs to be more peace in healthcare because there is a lot of stress. When there is a lot of stress, people act like they're at war. They try to fight, right? They try to fight for their health. And I'm always looking from the patient's perspective, really, because what are we doing up here on the provider side? Connecting providers, talking about alternative or complementary, and then the standard of care and the conventional approaches. What are we really doing? We are doing what we should be doing. There should be service to the patient, right? But a lot of people up there in the provider world where I currently reside, not being a doctor myself, I see that a lot of people think, what is it that we need as doctors? What is it that as we need as, people who are in this, biohacking movement and, healthcare providers that are not necessarily the standard of care, more on the alternative side, again, complementary side. How about we all look down or look towards, not down because it shouldn't be down, look towards the patient. What is it that this patient needs? And because they are truly trying to fight for
their life,
for their health, they deserve to receive peace. So you asked me about that pacifier. How are you going to be the pacifier? Through awareness, telling people that there could be a mindset shift that is both in the patient and in the healthcare provider. That is not a combat, even though it feels like it's a combat, because we need to fight. We fight with time. We fight against the diseases. But anytime we fight, the energy around it is not really that positive. And even though the outcome may be good, patients and providers sometimes get exhausted. The way that I have seen the best results unfold, including our own story with my wife, which I'm going to go a little bit deeper later if you would like.
Yeah, absolutely.
Was all with good energy, was all with good approach, with appreciating the best in every provider, even though none of them have moved the needle for Monica individually. All of them collectively have moved the needle. So having a good mindset about this, I think, is key. How am I going to be a pacifier? I don't see myself powerful enough to be the pacifier myself. But by bringing amazing healthcare providers together, educating the public, showing them, instead of telling people what they should do, showing them examples, showing how it can be done, featuring success stories. These are things that give me chills because I have experienced this we have experienced as a family. And I think that's how healthcare should be practiced, is to realize that sometimes we don't have all the answers. And most of the time we don't have all the answers. And all we can do is do our best. But doing our best does not mean treating ourselves as the best. And that's what I see as one of the problems in healthcare, is that everybody is in this, box, four walls, and doing their thing the best that they can. But there's another box next to them. And I think if patient had access to both, they can improve, because a lot of times 1 + 1 is more than 2.
Yeah, you're correct on that. When you brought up awareness, I was praying for hearing the word education, because you cannot bring awareness without having people educated. And then you brought it up, you want to bring awareness by educating people. And I think that you have the finger on the start button there, because that's the only way it works. It's like, you can bring awareness, but people most of the time don't want to listen because they reject most of the principle and the concept that we are creating, from biohacking to medicine, pharmaceutical, whatever. But if you educate them with the why, they understand, and the why becomes the what, the reason why they are going to do what is required to do. And so this is how you you are the pacifier in a way or the other.
Like the pacifier.
Yeah.
Maya, she's 10 years old, my daughter. 10 years old right now. Just yesterday.
Oh,
She was a
happy
baby,
birthday.
right? She was a thank you. She was a baby just yesterday, right? That
Mhm.
time is flying so fast. And then thinking about the pacifier and that analogy that you're making is just it brings really good memories. So thanks for using that word.
Yeah. Mine are far away. She's almost 20. So, yeah. But it's always good memories. Yeah. Family. When you think about family and everything that is related to family, you find a purpose of your existence on this planet. So tell me a bit more about your personal story with Monica, your family, and what happened. You being someone that is so connected in this world, what was the nightmare that you've been going through? And it was a great struggle. So if you want to share that story, I would just love to have it with our audience and sensitize them to the reality of what it is. Even when you know people, even when you know doctors, you can be stuck.
You can definitely be stuck. And I'm smiling when you say nightmare because with the right mindset, we know that there is always a silver lining. There is always something good in every, adversity, in every situation. We just have to understand that it's there, even though we cannot see it. And that was our case. It was very hard to find it when you see that there are some major problems with Monica's health, which I'm going to share with you and your audience. At the same time, knowing that something is there that we can use as fuel for something better, just that belief, that's already helpful. And that's something that also brings control to all of us, because when something goes wrong, no matter what it is, health, business, there are different situations, right? I think one of the fears is that we do not control it. Like that's big because it already happened, and now there are consequences, right? It could be a health challenge, could be something happening to us in another way. And I think one way to bring the control is the control of the decision. Like Tony Robbins says, what does it mean, right? And it's the same but slightly different. What am I going to believe right now? What do I believe to be true? And if I believe that my operating system, our operating system as a family, allows me to move forward, trusting that if we do our best, but we have to really be truthful, no BS, right? Really do our best, then and only then things are going to improve drastically fast. And also when we hit the point of improvement, this is the most beautiful thing, and I see it in my colleagues and friends after adversities as well, is when we hit the point where we already improved, if it's driven by so much passion and so much belief and faith, and also that something becomes your purpose, not just a mission to you can't stop. You cannot stop at like, okay, I'm back to normal. That's fine. Because now you're more aware that other people may have the same problem. And if your mission is about solving that problem, I think it just gives you this power of momentum that you keep going, and you're like, how much can I push it to extend it to other families, to extend it to other people?
That is empathy and compassion. Yeah.
And
it's not given to everybody.
Yeah. Because, what are we going to do with this? We can improve, which is extremely important to us. We can improve our lives, right? Great. But there are more people than us in similar situations, in sometimes worse situations. So if we can do something to give people a helpful hand, a resource, some kind of a support, I think it's our obligation, moral obligation, and it's also our pleasure to give it to people if we only can. Because when the things go really wrong, it's like in the old Terminator movie that everything kind of like goes black, and then you have this white dot, and it's not a good feeling, because you feel like you really cannot focus on anything. You're literally bathing yourself in this negative emotion for a second. And
it's like the eclipse yesterday.
Yes. Except the dot was a little bit bigger because it was the moon.
But you couldn't concentrate on anything.
Yeah. But, in that moment, I think the cool thing is to just shift the perspective a little bit, and just like Eckhart Tolle, the power of now, he talks about observing yourself in the emotion that is currently happening, but not actually being yourself. That gives you perspective, and then you can guide yourself. You can guide the family a specific direction. You can actually take action because you want to help these people that you're observing, and these people are you and your wife and your daughter.
Right.
And it's again bringing the sense of control. So I know I'm not giving any details at this point yet, but our story is only relevant to the viewer or listener if it's relevant. So I would like to share certain things, not just our story, but it's also certain things that people can take away from that story and apply.
You need to identify to whatever you listen to, otherwise it turns to be a personal story that no one wants to hear. You're right on that. So I like this introduction you made, actually.
Yes, thank you. So you asked me about our, you said struggles and our stories. We could start in Poland. We could start here. I'm just trying to think what will be the most relevant.
How long was that ago, and what's the time frame, like the sequence? To put everything that is memorized in your brain needs to follow certain patterns so you can recognize them and keep them in memory for a long term. So I would suggest to start by dates or moments or years, and then say I don't know. And then people will exactly remember how you went through that process, even if it's accelerated at the end. But still, it gives a perspective.
Okay. So I will start, not at my birth, right? Because that was a while ago.
Maybe it's gonna take 2 or 3
I want to give people context. Yeah. Well, if you have 5 hours, I guess we could attempt, right? All right. So we could start with just a little bit of context, right? So I was born in Poland. That's where I graduated in the university, and that's where the journey started. But I was always very curious, what's out there, and I loved traveling and loved exploring the world, and also understanding that there's always much more beyond my little bubble here, right? So I was very, very, very curious. So now seeing so much out there, I wanted to start pursuing. And actually, I started, I lived in London for a few months, then came back. Then I lived in the United States for a few months, then came back, got my master's. And then we decided to come back to the States, and we stayed here for a little bit longer. And that journey was very interesting for me because the office that I was working for was a healthcare office. And then I'm fast forwarding a little bit to the moment where I'm with my serious job, right? Mm-hmm. And being that person in the healthcare environment, and it was a chiropractic office, but it was a physical medicine office that is way beyond chiropractic. Then at some point it got medically integrated. And I started as the marketing guy. Then I was, promoted to other functions, and I was doing consultations, and eventually became a vice president of the office, vice president of service, and running the meetings, helping the office grow, and seeing how awesome it is to be a healthcare facility, because my identity is also attached to what I do. I know there is some controversy. Some people say, do not attach yourself to what you do, because if it's gone, there is a problem. But at the same time, if you really care and you attach yourself,
if you have a job on passion, or if you are your ikigai and you're doing what you love,
I'm attaching myself. So that's my personal choice.
Yeah.
And then if it doesn't work for any reason, then I can reattach myself to something different, no problem.
Yeah, and adjust.
But I think if we care so much, it's good to be fully there for people. So for me, the biggest joy was not the business side of it only, because that was more like I was seeing this as a more of a career, but it was a very different viewpoint about healthcare. Chiropractors have a fantastic way of looking at life, always looking for the reason why, always looking for the cause, always looking for allowing our body's innate intelligence to fix the body, because our body is smart. And I was fascinated with this, right? And then when the office started growing and I see so many opportunities that the office is helping other people, then I had a lot of belief, and that's something that also fueled our journey later, a lot of belief that things that seem impossible can actually be possible if we have a good strategy and if we apply it, right? Then there was we had a wellness center / weight loss office that I was a co-owner of. So imagine lots and lots of success, clinical success in our practice there, and not a small one, because not including weight loss, I think we were seeing approximately 300 patient visits a week plus. So So
wow,
not a
that's a
small
lot of
operation.
of fat.
No, not including weight loss. That we're talking about the
Okay.
physical medicine.
Oh, okay.
And I was seeing this as a fantastic proof that more is possible that people were told by their primary care physician. And I said, okay, super. Now, after Maya was born, my wife, Monica, we met each other here. So I wanted to give you, so that was approximately, I
10 years
started,
ago?
I started 10 years ago when my Maya was born. Thanks for remembering this. I started the work in that office in 2006 to 2016. So that was 10 years.
20 years ago almost, yeah.
Yeah. So that was 10 years in that office. And approximately, so after Maya was born 2014, Monica started having a lot of problems, a lot of health problems. The problems started with, it was her abdominal pain, and it was a lot of symptoms that were just weird and not easy for us to diagnose what exactly is the problem, right? Because it was not IBS really. It was not, the typical symptoms that you have a simple solution for. And then, we tried a lot of different things. And then we find out, I'm fast forwarding through a lot of different situations.
Steps and situations, stressful situation, I can believe, yeah.
To be relevant here for the people, because other people can have the same situation, they go to the doctor, they sit in this waiting room. And for me, it's our diagnosis, because if you love your wife so much, it hurts equally as much.
Of course.
It's for the whole family. And then we find out, okay, it's Crohn's disease. But the person who gave us this diagnosis was a medical doctor who was very dry in her communication.
Like
just
many
said,
are.
I know what I saw.
Yeah.
I know what I saw. It's very serious. Here's the pill, and basically go home. And a lot of people have it. Diet has nothing to do with this. That's what she tells us. Diet has nothing to do with this, even though it's a digestive system issue. Yes, it's autoimmune, but it is also a digestive system issue.
I think that Crohn's disease was first diagnosed as a genetic disease at the beginning. Am I right?
I don't know the history of Crohn's diagnosis, how it was evolving, but I know there is definitely a genetic component when it comes to being more prone to having autoimmunity, and then autoimmunity manifests itself multiple different ways. That's why people have multiple different ones more often than not. Yeah. So if that's the case, so we're like, okay, it's Crohn's disease. And then my mindset, imagine, it's like all this clinical success in the office. We'll say, okay, well, maybe we'll try some, functional medicine approach and this and that. And we are asking questions that are really driven by hope, right? And this doctor says, no, I don't want to hear about this stuff. Here's the pill. She gave us the pill for Monica to take. She needs to take it. She will be in and out of, doctor's visits. It's very serious. But a lot of people have it. Medicine is advancing. Diet has nothing to do with this. Go. And then she goes home. She tries that medication, even though we are so natural. We don't like to take pills if we don't have to, unless it's awesome supplements, then we will. And, and she doesn't improve, and it's getting worse. And to give people context later on, we also find out that it's not just Crohn's disease, but it's also endometriosis and a bunch of other things, including SIBO. And so basically you're hit with multiple different problems, chronic diseases. And it's really hard to have that one pill change the life of a person, especially that Monica was just experiencing some really bad side effects. So Monica being younger than me, so imagine in her early 30s, she is asking me, going uphill, maybe 15 degrees hill, if she's gonna make it. And she's not asking me if she's gonna make it up the hill, but if she's gonna make it. Yeah. That's tough.
Terrible. Yeah.
That's tough. So that night, we were laying down in bed, and I told Monica, I don't know how, but I know there is something good in this. We're gonna get you better. We're gonna make this a positive thing, and we're gonna make this something that is actually a net positive. And I don't have all the solutions, but I will do everything to find it. And imagine in my own mind having so much clinical success as a practice, and I cannot help my wife.
Yeah, that's
in
the
office
thing.
doing consultations, telling people everything is possible, almost making it easy, and then knowing that my wife is not improving, even though she's trying different things. That was not easy position to be in. But there's a beautiful journey after this with a very, very, very very good place that we are in right now, and we can only appreciate.
Yeah.
We can only appreciate where we are because we know life has ups and downs. So I don't want to
And
make
it's
it
always
seem
like that. But yeah.
yeah.
So at that point, I'm going to ask a couple of questions that maybe many people would ask. What was she eating? What was her stress level? How was that life? Why did you bring up that it's after being pregnant and giving birth that it started? Or why are all these, so those small points that are super important, but are questions that you often hear from people getting sick and they go like, what happened to me? What did I do wrong? Was I doing some things wrong? So can you tell us a bit about what was Monica's lifestyle parkour? What's the link with the pregnancy and giving birth? And then we keep going on the what you've done after that, if you don't mind.
Okay. Yeah, very, very good point. So without giving more information that Monica would like me to share, because I don't know where that line is, so I'm going to try to be careful. Overall, we had a healthy lifestyle without making it super healthy. Like right now, we are trying to make it super healthy, right? So the awareness was on a level that is definitely more than average. We were eating good, avoiding garbage, but not to the point that it is right now, right? But overall, if I look at this society, especially here in America, we actually had a healthy lifestyle, healthy relationships, good mindset, lots of smiles. We did have quite a few, parties and normal activities.
Normal life in the 30s, normal life.
So there was. I'm not trying to paint a picture that it's a perfect, healthy lifestyle, because some people right now tell us that even a glass of alcohol is a problem. So that is, and I know when I met you, you said, no, I drink wine, right? So I don't see that as a automatically unhealthy lifestyle, but I just want to paint a picture as it was. We had a generally healthy lifestyle. Why pregnancy or the childbirth played a role in this, in my opinion, is because the childbirth here, in Monica's case, was a little bit different. We had we really wanted to do it was with epidural, but we wanted to go naturally without surgery, right? And because of the position that Maya was in, that was nearly impossible, if not impossible. Monica was trying. So imagine the exhaustion from having over 24 hours in labor, which is a really, really long time.
That's a long time, yeah.
Having, Monica is a soldier, she's like, not literally, but you know what I mean? Like, she's not
special forces more than a soldier, 24
pretty
hours.
much, sometimes tougher than them, so she's in a good way, and and she was really trying. And even though the doctor was saying, are you guys sure? I said, Monica, are you sure? And then she's like, yes, let's try one more. And then it just didn't go. On top of this, she had IV antibiotics because of something that they found and they recommended. So I think that weakened her immune system.
Makes sense.
Quite a bit.
Yeah, the shock.
Now you also add the stress, right?
Yeah.
And then after the delivery of the baby, of Maya, which was so beautiful, and right now she doesn't remember any of this stress. She's like, it was just awesome, and Maya just showed up here in our life. When we went home, Monica really quickly, she went upstairs in our place, and I'm like, what about the stairs? She's like, what stairs? I'm like, they told you to be careful. I said, oh, I guess I forgot. So she was strong. She was good. But after that, she had an ear infection, and we met with this doctor who also gave her antibiotics. And knowing from the chiropractic world and the natural medicine world, knowing the risks of it, I had a major problem. But because of pain and the medical advice that was given to us, now another round of antibiotics. And what I think is you have exhaustion from the childbirth, multiple rounds of antibiotics, weakened immune system, the
stress, cortisol,
a lot of stress, not sleeping, and I think all of that played a role to all together. That
and no recovery, like you said, yeah.
So the interesting thing is from that moment, right, that we decided we will do something about it that is going to be a net positive. We will make it, because quite frankly, there's no other option. I do not see a life of complaining as a life that is, it's just not the way that we live our life, right? We're going to say, okay, what can we do step by step? step. Monica is action driven. She's like all the time. It's like, we got to take action. Let's plan, let's strategize, action. Plan, strategize, action. Correct, and then action. So with all this, we said, okay, what can we do? We went the functional medicine route, and I had a really good network of healthcare providers, luckily. And we just asked, we were not afraid to ask for help. So we just asked everybody for help. And one person said one piece of advice. We took it. And again, integrative medicine, integrative healthcare.
Integrative information at that time. Yeah.
We are taking that piece of advice. And then we apply it, sometimes with success, sometimes without success, right?
Okay.
Then there is another one. With functional medicine, I also wanted to know, who would be a good person who also teaches other providers how to do it? Because I don't have time to play, this game of like a doctor tells a doctor to tell the doctor to tell the patient. No, I said, this is my wife. I need access, if I can, to the top. And people were very, very helpful, and I can only be grateful. So with all these connections, we did a battery of different tests. And because you meet with people, including Brian Johnson, who has so many different tests.
We did not go test every day. Yeah.
Yeah. It's fascinating because, we didn't go too extreme, but comparing to where we were, we did a lot of testing. And what is testing? Testing is valuable information, right? So now we have points of information, data that we can do something with. Are we equipped with the answers or even a way to synthesize all that data? And no, but again, we have the network of providers. So we ask and we try. Monica went through minimum of 15 different diets, including diets that a lot of people have no idea that they exist, like low FODMAP. Like she went all the way from vegan to, not that she started with vegan, but I'm giving you the spectrum from vegan to carnivore.
Yeah,
right?
everything
like all these
in
different
between.
diets.
Yeah.
And I think all of them, played a role in the educational journey. Yeah. And the diet that actually helped her the most was ketogenic diet. She was on keto for 7 years.
7 years on keto diet?
7 years without any cheating. And
wow. Because, most of the time we say that keto diet is not sustainable, not in the long term. 7 years.
Yes. For Monica, it was, so imagine this, with all the functional medicine testing, I'm going to get to keto in a second. I just want people to know that was not what pulled her out. That was not the solution. It was just one of the things she landed on.
One of the factors
that was very helpful. And I think one of the biggest advantages of ketogenic diet is lowering inflammation. Mm-hmm. And it's also the elimination of a lot of crap that was giving her problems. And on top of this, having this alternative source of fuel for your body that was allowing her to still function even though her regular baseline energy level was not there. So from the functional medicine battery of testing, one of the things that she found out is that because of her leaky gut, there was also present, which is, very, very common in Crohn's disease patients. Yeah. You have so many things that you are now sensitive to. You cannot eat. So she says, okay, so what can I eat if I cannot eat all these things? And then when we switched to what can she eat, she tried. And then she tried something else, and she tried something else.
Trials and errors. So trying, rejecting. Okay. Yeah.
Also, consulting with a lot of different people, doing a ton of different tests, and going from this, one doctor who was it was a very proper standard of care doctor, but a very disappointing doctor from the integrative healthcare movement perspective. Because that doctor, when Monica improved, I'm kind of jumping a little bit, but when Monica improved, I called the doctor and I said, Monica has improved so much. I wanted to speak to her, even though it's not really easy to get a doctor. I got her on the phone and I said, I would like to send you the tests, the results, and also, a brief description of what we have done. So you will know, because she's your patient, so you can also help other people. And she is doing so much better. By the way, she's not taking the medication, even though I know you told her that she will need to take it. So we apologize, but she was not doing good on it. So this doctor told me, Mr. Turajczyk, please don't. I'm like, what do you mean? Don't send it to me. I'm not going to even read it. So I was like in shock.
What is about, ignoring the Hippocrates sermon is one there. They're not supposed to do that as doctors.
I'm trying to be very, very understanding, and I found a way to be extremely understanding here. So I don't want to paint a picture that she was a bad doctor. I think she could have received the information, but I want to understand why she didn't. So I'm in front of Panera Bread on the phone with her, with steam out of my nose and my ears coming from frustration. It's like, what do you mean? We have accomplished something that for our family, it just means that she can go outside and, do something that is, basically participate in life. And then you say, I'm not going to even read it. And then I learned that you should not ask people why, because they can get defensive. So I said, may I ask you what's the reason for that? And she says, I'm just not trained in that.
Oh, but that's a good excuse.
And I said, okay, thank you.
Yeah,
hang up
makes
the
sense.
phone. That moment, that's where the understanding comes. That moment I realized something. And that
starting a war most of the time is on misunderstanding.
Yeah. And I always try to understand the other person's perspective, because we are always looking from where we are, because that's the lens that we have, that's the position, right? So from my perspective, it was like just not practicing proper medicine because you don't want to know what helped your patient. The other perspective, I'm not trained in that. And understanding her perspective is, okay, if you're not, then maybe you don't have that time in your schedule to get trained in something. Maybe you're going to recommend something based on, the N equals 1, and you're going to hurt another patient because what worked for Monica may not work for somebody else. I'm trying to be very understanding. There is one conclusion. For us as a family, one conclusion, we're changing the doctor 100% right away, right? So we did. But there is also another conclusion that is the driver for everything that we do, which is, the conclusion is, there are some doctors who are standard of care with blinders, and they just have the very narrow viewpoint. I'm trained in this, that's what I'm going to do. And there are doctors who have an integrative mindset, who would gladly receive it even if they don't understand it, who would gladly collaborate with other people. And I just said, I will make my life all about helping these guys, integrative healthcare providers.
This growth mindset is exactly the same reflection on every aspect of life, business, relationship. Narrowing your vision and your understanding, or even your opening to understand things, doesn't go from growth mindset. So the problem with others that are not into that pattern is because they've been educated to be in that bracket. Why some doctors are open to integrative medicine and not others? What's your take on that? Is it the mindset? Is it their training? Is it just the personality of the doctor?
I don't fully understand it.
Okay.
So this is one of the things that I don't even know if that I'm from Poland. So I'm going to use the word that I don't know if it...
That's not an excuse. No one's perfect.
It puzzles me. It puzzles me. I don't know how to put these puzzles together. I don't understand it because, again, I'm looking from my perspective. I really don't understand it. Why would you, as a healthcare provider, choose to do, let's say you're using the hammer in the right way to put the nail in the thing, fine, and that's what you do. If you knew that there could be another way to achieve the same or better outcome, why would you not know, or why would you not want to know about other tools? I really don't understand it. I understand that there could be a reason. I don't fully understand it.
I'm going to get you that answer. Why you're doing your job? Because you have a purpose on what you're doing, and because it's by passion. You started by that point. You said that you are attached to what you do. Here's the answer to your question. They're not attached to what they're doing. It's a job.
Very, very possible. That's the reason.
Yeah.
Very possible.
That could change. I don't think it's their mindset. It's a job. Point. Yeah.
If somebody has that kind of a mindset, then why would they? It's extra work, extra time, extra attention with an unknown outcome. That makes a lot of sense.
Yeah. It's sad, but it's like, it starts again from where we were. It's education. It's personal life. It's a balance of everything. We chase the things that we don't have to pay with the money we don't have because we want to impress the people we don't like. And it's a circle that goes that way. And when you end up doing 11 years of med school and you do a job, I'm sad. I'm sad because my whole family are doctors. My daughter, she's in med school. I don't want that. I want these guys to be open as you are and to understand that, if something doesn't work, maybe there's other solution. It's not only what we've been taught in books and at school. Yeah.
I'm very optimistic because we always have a choice. And your daughter has your genes. Yeah. She'll be fine. She will be okay.
If you look at her today, no.
There's one thing that I really want to make sure that we paint an accurate picture here for our viewers and listeners, because Monica is doing so good right now. Awesome. I am so proud of her. So without giving all the details about the process, just know there was a lot of different things and lots of ups and downs, including, not being, active as a part of society. We love meeting people, meeting with people. We're very social people.
Yeah.
And then if everything is around, and also with her endometriosis, everything around her cycle and how she feels and the pain and will I do okay? You cannot plan a trip. You cannot plan a birthday party. Everything is very, very different. So from that negative point to now very positive points, I will give you a lot of things that I think for somebody who has the same situation, they can practically use. And I have some tips for people as well.
That's what I want to hear, because, here I had this question on my lips coming up. Would you be able to write a book, How to Solve Crohn disease?
No, because it's not about Crohn's or endometriosis or anything else.
Yeah.
It actually is about integrative healthcare. So look at this.
Love it.
Monica, right? Monica, I'm going to fast forward a little bit and just know that there was a ton of different, fantastic twists of this. One of the surprising twists was I told Monica when she started her ketogenic diet, I said, listen, you don't have to do it alone. I can jump on it with you. So check this out. And then she says, okay, well, sure. And then we started eating together because it's easier to cook this way and all that stuff. If she doesn't have to cook a separate meal for me. You know what? And she says, you don't have to do it anymore. I felt so good that I stayed 3.5 years.
Wow. It's like a couple quitting smoking. If one keeps smoking, the other one will keep smoking. That's like love. Yeah.
She told me you don't have to do it, but I'm like, but I enjoy it in my line of work, in my professional life, in my personal life. I like to be, I consider myself a high performer. I want to do good for society. I want to be 100%, 110%. How can you do it? On that diet, I was able to do a ton more than I would normally be able to do. So I'll tell you that ketogenic diet episode, which was a long one, 3.5 years for me, 7 years for Monica, was extremely helpful. Maria Emmerich helped us a lot. Maria, Craig, they trained Monica. She actually became a ketogenic diet coach. At some point, we really thought that ketogenic diet is the solution to a lot of problems. And right now, Monica is more about it always has to be customized. Okay, everything has to be customized. Yeah. It played a role in her journey, and she even started a business, about ketogenic diet coaching and all that stuff. We when she was cooking, I said, let's make it fun. So we recorded videos because we like videos, so we recorded videos. We have this whole channel with recipes that are gluten-free, keto-friendly, low-carb, whatever. Awesome. So now imagine this, Monica right now, completely different person. Spirituality, 10 out of 10.
Yeah,
10 out of 10. Her morning routine, waking up at 5:15 a.m. about 90% of the time. 90%. So it's not like sometimes I wake up. Almost every day she will wake up, go downstairs when we are sleeping, gratitude journal, her energy cheek oil medicine, her brain tap, her meditation, her workout. We bought tonal for working out, which is a very interesting. We wanted to test it for our doctors group, and is it legit? Is it good? It is. It's awesome.
Yeah, it is.
So she works out and all this, and then when she's all done with that morning routine with so much energy, now I'm gonna wake up, and the whole family, starts, getting up when Monica is already doing so good. So much energy, so good. The doctors who are around us are fantastic, including the new GI doctor who said, listen, I know what I saw. Remember, we have this little test here that I told you that it's a crystal ball, and I know what I saw. And I respect that you don't want to take the pill because there were more attempts here. But I wish every doctor was like that when they're not fully integrative. He said, my daughter is a chiropractor. I understand that viewpoint. I just know what you need, and I know you're going to be back. But hear me out, Monica and Mike. I understand and respect your choice. And no matter what you do, I'm going to still be your friend. I'm like, this is beautiful. Every doctor should be like that. It's awesome.
Yeah. So you find the motto of a company there.
Yes. So right now we have so much that we learned from this whole journey, so much that I want to give people some practical tips. And there are some tips for patients, for individuals like we are, right? And then also for providers, because I think a lot of people talk about this integrative healthcare, but they don't know how do we practice it, right?
Yeah, and everybody says that it's going to be the future of medicine, but no one knows how it's going to be the future of medicine.
Yes. So for us, a couple of things were helpful, but but a couple of things were really needle movers. So what I want everybody to know is number one, mindset. Number one, integrative healthcare mindset. So let's say now let's focus on patients, individuals, right? So somebody is an individual and they have an integrative mindset. When they go to a doctor, they expect this doctor to help them as much as they can, but they know that this doctor is not going to give them one pill with the expectation that that one pill is going to solve all the problems. For small problems, maybe, but for chronic diseases, it's almost never that simple, right? So integrative mindset, just knowing, so, okay, this is a doctor on my journey, right? So have that mindset. The second thing is prevent if possible. If possible, you prevent a problem. Okay. So even before we start talking about solutions, look in the mirror today and ask yourself, how is my health? How is my, even if there's no major problem, how is my morning routine, evening routine, day routine? And is there anything in my lifestyle that I can change to prevent disease? There are so much conflicting information when it comes to diet or exercise. I'm not going to even go into the details, but there are some common denominators, things that we know that we can do, like practice positive mindset, eating real food versus highly processed food, reducing sugar, like, you know, all the common denominators,
controlling salt and like the baseline of healthy life.
Yes. So prevention, if you can, try to prevent before you start, addressing the problem, right? Because maybe you can prevent the problem. Now, let's say somebody is going to the doctor and the doctor gives some answers. I think one of the things that we need to do as patients is ask questions. We need to ask questions about the cause.
Yeah, most people, they are afraid about asking questions. They will go back home and then try to find answer on internet instead of asking question. That's a good tip.
Yes. So when you are, I'm going to go straight to the camera. If you're at the doctor's office and you hear something that you are just curious about and you don't fully understand, you ask questions. What's the reason why? What can we do? You ask questions, powerful questions that are going to get you a better outcome. Asking about different testing that is available. What else can we test to get more information? Because there are tests that are included in your insurance profile or the coverage, but there is the whole portfolio of tests that are outside insurance that could be very helpful. So your healthcare provider may be able to...
More and more. I've seen recently like cancer screening. I think 50 type of cancer screened. It's not on the healthcare system yet. It's a private company doing that.
Yes. So I think that goes to another point, educating ourselves as patients, coming back again to education, on what's the latest and greatest, what's new. And we don't have to do all that research ourselves because we can always ask for support. We can have a network of support, which I'm going to get to as well. Being in charge. So really the patient is in charge, not the doctor, but it doesn't look like it because you're coming in and the doctor, what is the doctor going to tell you? Have a seat, put this. I'm going to measure your blood pressure. I'm going to do this. What did you do this? Oh, what are you going to do? What do you take? How do you feel? It seems like the doctor is in control. I think that the conversation, that part of the conversation, of course, the doctor is in control, but you are in control over your health, not the doctor. You can change the doctor. You can't change you. So just realizing, again, it's a mindset thing that we are in control versus that doctor controlling my health. Because what's the next thing? If the doctor doesn't get you the outcome you want, you blame the doctor. That's an easy way out. Don't blame the doctor, I say. Don't blame the doctor. Take responsibility yourself. If that doctor could not give me the right advice or recommendation, I'm going to find another doctor or try a different protocol. But blaming the doctor doesn't solve a problem for you. Another one is record keeping. Such a simple thing that we can do. So let's say there is a chronic problem and you feel like crap and you really, this is not the time to look for your MRI reports and all that stuff. Have a place with all your records. And then when you go somewhere, just grab a link to this, send it to the doctor.
Because the history, sometimes like the history from Monica was the trigger of the stress, what we said before. And some people, they just forget, like they get sick once and they go like, whoa, okay. But sometimes it can be explained by what happened before. You're right. Yeah.
And doctors love, the integrative healthcare doctor, they love to have that information.
Of course. Yeah.
So I think this is very, very powerful.
Cool. Yeah.
Adjusting the lifestyle. I'm going to just go through a few of them that are, important for people to know. Adjusting your diet, more focusing on quality and adjusting it to the the point in your journey that diet is needed. Staying hydrated. A lot of people forget about this. They focus on diet. They don't hydrate properly. Avoiding harmful substances and habits. So it's not only what we, what we take, but also, the lifestyle. Some habits are just toxic, and there are some toxins around that we need to avoid. Mental health, psychoneuroimmunology. We talk about this all the time, right? So your mindset, your mind can affect your body more than you think. Believing matters. Physical activity, you talk about it all the time. Prioritizing sleep, very important. A lot of people forget. Investing in biohacking, I put here on my sheet.
That's commercial.
People will invest in a new car, right? People will invest in some weird things that I don't fully understand. When your priorities shift, investing in biohacking is actually
it's investing in you.
It's investing in you. So I think that's a good idea.
Yeah.
Believing that you can improve, that comes back to mindset, and having a support network that you can join, like
be
our
part of a community. Yeah.
Because you don't have all the answers. You want to be able to ask a question and then get the answer.
But can people ask question on your platform, or is just
Definitely.
Doctors? Yeah. Okay.
No, they can. That's why when I tell people, don't be confused with the numbers, right? So we have over 500 people there in the group, but maybe 150 providers only. Is because I want this to be a resource for our community, so they can come in. Like my friend, she had a problem with her hand. Anybody knows a good hand surgeon? Boom, somebody replies, go in this area. That's good. It's on a smaller scale.
Yeah,
that's
is
okay.
Insane.
But on a bigger scale, it's going to be very, very powerful. And for providers, there's also a lot that providers can do. And I don't know if your time allows to just go through the list of these things, or that's something that we do on the next podcast. Completely up to you.
Yeah, we have a couple of minutes to go. We exceeded. I just postponed my next meeting, so we have about 6 minutes. Keep going.
6 minutes. Okay. Yeah. So I'm gonna give a few different tips for practitioners, and if this is you watching, I think that can help a lot. Again, starting with integrative healthcare mindset. So the mindset, just knowing that there is much more than what you offer out there. Having a holistic approach. So instead of looking at the problem only, like let's say there is a digestive system problem, that there is a holistic approach that can manifest. There could be a reason somewhere else that manifests itself in the digestive system. But having a holistic approach allows the doctor to know that if I am, for example, a heart specialist, right, and I would like to cardiologist, and I would like to take care of the heart, diet is not my specialty, but diet affects the heart. Right? Personal trainer is part of that treatment for the heart, but it's not their specialty. What I'm saying is, with integrative healthcare mindset, you collaborate with these people. And that's my next point.
Portrait,
You collaborate. I also put on my list active referrals. Instead of just telling people, go on Google, find a personal trainer, which is still much better than not. But saying, you know what, we have some, I have this network, or, I have somebody, I have a chiropractor here I can recommend. I have a personal trainer who is here in our area. I don't know, try to contact her or him. These type of things, active referrals, that is very important. And then communication and follow-up, because that's where a lot of providers, when the patient leaves, that patient disappears. They're like, okay, next. And I understand why, because their schedule is busy.
Yeah.
If you're truly an integrative healthcare provider, you follow up with the patient and you say, how are you doing? Did that work? Did you have a chance to call them? Okay, just want to check. Hey, do you want me to talk to that doctor? Because if that little phone call means so much for the patient that the provider has no idea.
It's not a number anymore. Yeah.
Yes, following up. Considering lifestyle medicine is important. Stress management techniques, of course. Having
it's
a
all
network
biohacking in general too. Like it's all related to biohacking as close as possible there.
Of course. Educating yourself as a provider, how important that is, to actually know that what you learned 20 years ago is probably better now, which is very, very optimistic. So continue with education. Patient education as well, educating on options, let the patient decide, hey, there's a risky option here, there's a therapy that is not proven, but just letting you know there is an option. I think it's very, very helpful for patients to know this information. Empathetic communication, understanding where the patient is instead of just saying, this is what you do, this is what you have, diet has nothing to do with it, go home. That is not what you communicate, but also how. That matters a lot. Using technology, I put here because there's amazing
much coming up.
Technologies.
Yeah. Technologies and artificial intelligence and all these are part of the future.
Yeah. And I put one point here that I think is important. Always doing a little bit more than you have to. Always putting
the 1%, you mean? Like adding this 1% that makes the big difference in your life?
And if you really care, add 10%. And joining a network of practitioners, because
where people can find your network.
So for me, I make it easy for people. I just have this URL, polishmike.com, and I'm going to be always putting all the links and resources under polishmike.com.
Perfect. Okay, the simple way to find, because I saw that you have polishyourbusiness.com, polishmike.com, polishyourhealth.org,
polishyourlife.org.
Polishyourlife.org. So polishmike.com.
Polishmike.com is the best place. I put a lot of links there.
Nice.
And I just want to be helpful. Like Arnold Schwarzenegger says, be useful. I want to be useful. I want to be helpful. I want to be helpful for people. And utilizing the success that we have on our mini scale with our family, not just to say, okay, we are doing better, because that's meaningful for our family, but what can we do for society?
For others,
the resources.
Serve as an example. You are an example. You do great. You do great stuff, Mike. I love you for that and for many other reasons. And you are a good man. And I think that we need more people like that on this planet, making the good, not for chasing fame, but for the good of making the good. And this is what you're doing. And your story is thrilling. And what you do is even more. We at Life Planning, we're going to help you on that. That's what we discussed. We want to actually, when you were talking about this network and leveraging on it, I want to have actually people coming to our platform going to yours for advices, because it's there. So we can drive the 5 million people that are coming and visiting our platform, if they're in a need of something, to go to look at what you are doing and ask advices there. Yeah.
We'll always take them with open arms approach, honest approach. Our health, there's no doctor who knows it all. There's no doctor who knows it all. And that's why
there's no people that knows it all. It's impossible. Not even artificial intelligence will know it all.
And I really believe integrative healthcare is the answer, because so many people go from doctor to doctor. Even if they follow recommendations, they still don't get better. So we want to help. We want to help as much as possible. And with people like you connected to us, I know that this is like that 1 million. We may need to increase it.
Yeah, absolutely. Thank you, Mike, for being here. Thank you for sharing your knowledge, your wisdom, your story, and polishmike.com, where you have
Thank you so much. All the best.
Thank you.